Happy almost Halloween, everybody. Today, we are talking about a chronic disease that an estimated 2.5 million people live with worldwide, and approximately 200 new cases are diagnosed each week in the United States alone. Any idea what this might be? This way for multiple sclerosis in this month's Chronic Disease Spotlight. So let's first define exactly what multiple sclerosis is. And for the rest of this video, I'll refer to it as MS because multiple sclerosis is a mouthful to continually say. So MS is a chronic disease that impacts the brain, spinal cord, and optic nerves, which are nerve fibers that carry visual messages between the back of each eye or our retinas and our brains. The brain and spinal cord make up the central nervous system and controls pretty much everything we do. In contrast, you also have peripheral nerves, and they're any nerve in the rest of the body, legs, arms, hands, feet, skin, etc. I also want to quickly go over the parts of a nerve, so you don't kind of get lost in all of the medical terminology, which I'll try and be mindful of keeping to a minimum. So parts of a nerve. Axons are cord-like groups of fiber in the center of your nerve. Dendrites are branches that carry electrical impulses. When a nerve sends an electrical impulse, first, the signal travels down the axon, or the wiring connection of the nerve. The message then converts to a chemical signal, or a neurotransmitter, at the end of the axon. And neurotransmitters you might be familiar with are serotonin, dopamine, and acetylcholine. So these neurotransmitters are released into the space that bridges the gap between one neuron and another. And these bridges are called synapses. The neurotransmitter binds to a receptor of the muscle or connecting neuron and converts to another electrical signal. So this is kind of like a relay race, and the impulse travels just so far on one nerve, and then it's passed off to the next nerve or muscle, if that's its final target, and then movement occurs. The exact cause of MS is unknown, or what we like to refer to as idiopathic. But we do know that something triggers the immune system to attack the central nervous system, resulting in damage to the myelin sheaths. Now, remember earlier, we discussed the nerve impulses traveling down the axon of the nerve. Well, myelin is the protective layer that insulates our wire-like nerve fibers and streamlines that impulse so it's quick and smooth. But in MS, this myelin is now destroyed in sections, in chunks, leading to disruption of signals to and from the brain. Side note, which I think is worth mentioning, the reason that we want to have healthy fats in our diet is because polyunsaturated fats like, omega-3s and omega-6s are responsible for making these myelin sheaths. So whenever I hear somebody cutting out all fats, I kind of get a little worried. First of all, it's impossible to cut out all fat, but fat is absolutely needed in a diet for that reason. So in any type of demyelinating disease, the immune system has set its sights on a fatty myelin sheath snack and begins to take bites out of it. Now, because we're talking about MS, this is only happening in the brain, spinal cord, and optic nerves. This interruption of communication signals causes unpredictable symptoms such as numbness, tingling, mood changes, memory problems, pain, fatigue, blindness, and sometimes paralysis. Everyone's experience with MS is a little bit different, and these losses of mental and physical function may be temporary or they may be long-lasting. So again, The cause of MS is not known. Scientists believe MS is triggered by a combination of factors, including an abnormal immune response, which is the first trigger we're going to talk about. Two important types of immune cells involved in the immune response related to MS are T cells and B cells. Remember them, okay? So we're going to talk actually about three types of cells next: T regulatory cells, T killer cells, and B cells. T cells become activated in the lymph system and enter into the central nervous system through blood vessels. In MS, once these cells are in the central nervous system, they release chemicals that cause inflammation and damage. This results in damage to the myelin, nerve fibers, and the cells that make myelin. Normally, T regulatory cells, which are a type of T cell, are responsible for the dampening or turning off of inflammation. In MS, T regulatory cells are not functioning correctly and do not effectively turn off inflammation. That's the first issue. The second issue involves killer T cells, which directly attack and destroy cells bearing certain characteristics, such as bacteria or foreign antigens or anything that's looked at as a foreign invader in the body. B cells become activated with the help of T cells. B cells produce antibodies and stimulate other proteins in MS. These proteins cause damage in the central nervous system. Second, although, as I've said earlier, the cause of MS is not known, more is being learned about environmental factors that contribute to the risk of developing MS, which is next on our list of potential triggers. There is no single risk factor that provokes MS, but several factors are believed to contribute to the overall risk. MS is known to occur more frequently in areas that are farther from the equator. Studies have shown that people born in an area with high risk of MS, who then move or migrate to an area with a lower risk before the age of 15, assume the risk of their new area. I found this so interesting. I actually used to be an MS certified nurse. So reviewing everything for this video it kind of jogged my memory, and I find that so interesting. And the environment definitely plays a role in chronic disease, and it's proven, it's pretty evident here with MS for that reason. Such data suggests that exposure to some environmental agent before puberty may predispose a person to developing MS later on. Low vitamin D levels in the blood have also been identified as a risk factor for MS. Some researchers believe that sun exposure, or the natural source of vitamin D, may help to explain the north-south distribution of MS. People living in warmer climates get more sun and, in turn, more vitamin D, which is thought to support immune function and may help protect against immune-mediated diseases like MS. The evidence is also growing that smoking plays an important role in MS. Studies have shown that smoking increases a person's risk of developing MS and is associated with more severe disease and more rapid disease progression. Fortunately, the evidence also suggests that stopping smoking, whether before or after the onset of MS, is associated with a slower progression of disability. So that's really good news. Obesity. Several studies have shown that obesity in childhood and adolescence, particularly in girls, increase the risk of later developing MS. Other studies have shown that obesity in early adulthood may also contribute to an increased risk of developing this chronic disease. Obesity may also contribute to inflammation and more MS activity in those already diagnosed with MS, which makes sense. Anytime you see an obese person, Usually their blood work indicates that there is inflammatory processes going on. Next is infectious factors. Many viruses and bacteria, including measles, canine distemper, human herpes virus 6, Epstein-Barr virus, and we're going to talk more about that momentarily, and chlamydia pneumonia have been or are being investigated to determine if they are involved in the development of MS. EBV, or Epstein-Barr virus, which is the virus that causes mononucleosis, has received significant attention in recent years. A growing number of research findings indicate that previous infection with Epstein-Barr contributes to the risk of developing MS. Genetic factors. MS is not an inherited disease, meaning it is not a disease that is passed down from generation to generation. However, in MS, there is a genetic risk that may be inherited. In the general population, the risk of developing MS is about 1 in 750 to 1,000. In identical twins, if one twin has MS, then the risk that the other twin will develop it is about 1 in 4. So definitely a link there. The risk of developing MS is also increased when another first-degree relative like parents, siblings, or children have MS. Evidence for the role of a virus in MS. Several factors suggest that an infectious agent is involved in triggering MS. Data from epidemiological studies, or studies that analyze the geographical, socioeconomic, genetic, and other factors that may contribute to who gets MS, suggest that exposure to infectious agents may be involved in triggering the disease. 90 to 95% of people with MS have proteins in their spinal fluid that are typically found in the spinal fluid of people with nervous system diseases that are known to be reactions to viruses. To date, researchers have not been able to identify a single virus as the trigger for MS. The case for Epstein-Barr virus, or EBV. Several studies by Dr. Alberto Asherio and his team at the Harvard School of Public Health have suggested that Epstein-Barr virus is absolutely involved in MS. Studies found that antibodies, which are immune proteins that indicate a person has been exposed to Epstein-Barr, were significantly higher in people who eventually developed MS. MS risk increased significantly following infection with EBV. So it's demonstrated that EBV was in the body before MS developed. And we're going to get into the diagnostic criteria in a little bit, and you'll see why this is key and actually pretty important. People with a specific immune-related gene and high levels of antibodies to EBV in their blood were 9 times more likely to develop MS than those without the gene and with low levels of the antibodies. And lastly, smoking. Current or previous smokers with the highest levels of EBV antibodies were 70% more likely to develop MS than those with neither factor. So what are the different types of MS? While there's no way to predict with any certainty how MS will progress, there are 4 basic disease courses that have been defined. The first is clinically isolated syndrome, or CIS, in which the first episode of neurological symptoms are caused by inflammation and demyelination in the central nervous system. The second is relapsing remitting MS, which is characterized by periods of relapses. And relapses are new symptoms or a worsening of older symptoms, also called an attack or an exacerbation. They subside with full or partial recovery, and no disease progression or worsening between these attacks. The third type is called secondary progressive MS, which follows relapsing remitting MS in some people and is characterized by a more progressive course with or without relapses or new MRI activity. So people with secondary progressive MS may continue to deteriorate and experience a gradual decline in function without periods of remission or notable worsening and no new lesions on MRI. So the way this disease kind of goes, it can start with clinically isolated syndrome. So those first neurological signs that something might not be right, maybe some numbness, tingling, maybe unusual forgetfulness, things like that. Experiencing weakness, when they normally wouldn't. So clinically isolated syndrome is kind of the first tip-off. I wonder if something's going on here. This is usually followed by a visit to the doctor, maybe some type of workup, and then a diagnosis. Sometimes, but not always, people are past the clinically isolated syndrome portion and are now in full-blown relapsing remitting, which is kind of the trickle-down effect from clinically isolated syndrome. So let me clarify this. Clinically isolated syndrome, it starts with first few weird neurological side effects. As it progresses, it will go typically into relapsing remitting, which just means that it's characterized by new onset of symptoms or a worsening of older symptoms. And then they start to improve, and then the person will go through a period of remission or no signs and symptoms or very, very mild. And then all of a sudden they'll go into another relapse. So it's kind of the roller coaster sawtooth pattern. And then from there, it can progress into secondary progressive MS, which just follows the natural course of action. Clinically isolated syndrome, periods maybe for years of relapsing remitting patterns, and then at a certain point, the MS just continues to get progressively worse, and function and the side effects will become more frequent and more prevalent, and there is a gradual continued decline. So that's the natural progression of the different types of MS. Lastly, there is a type called primary progressive MS, and this is characterized by a gradual but steady progression of disability from the onset of symptoms with few or no relapses or remissions. So again, rather than going through the different types that I just discussed, this person with primary progressive starts out with very evident MS type symptoms and just never really experiences any improvement or anything like that. They just continue to kind of gradually get worse and worse and worse until they're in significant decline, unfortunately. And up until recently, there were very little to no treatments for primary progressive MS. It was more of a symptomatic treatment type situation. So what are the typical symptoms of MS? So as stated earlier, symptoms of MS are unpredictable and vary in type and severity from one person to another and in the same person over time. Symptoms may disappear or remit completely, as in relapsing remitting like we just discussed, or they may persist and worsen over time, such as in primary progressive. The most common symptoms of MS include fatigue, numbness and tingling, blurred vision, double vision, weakness, poor coordination, imbalance, pain, depression, and problems with memory and concentration. Less commonly, MS may cause tremor, paralysis, and blindness. So what causes these symptoms? Inflammation from the attacks on the immune system in MS causes damage to myelin. Myelin, again, is the protective insulation surrounding nerve fibers. Oligodendrocytes, which are the cells that make myelin, and also the underlying nerve fibers. So thinking about these symptoms, the double or blurred vision is because the optic nerves are affected. The fatigue, numbness, and tingling is due to the nerve impulses not traveling quick and smooth down the nerve and swan diving over the gap to the next nerve. It's arcing and struggling to get down the nerve axon, and when it does get there, the neurotransmitters like dopamine and serotonin, as we mentioned earlier, are depleted and exhausted and may not be sufficient to get the impulse across to the next nerve, leading to fatigue, numbness, tingling, etc. Symptoms may be temporary or permanent and may worsen over time. Does MS always cause paralysis? No. Moreover, the majority of people with MS do not become severely disabled. 2/3 of people who have MS remain able to walk, though many will need an aid, such as canes or crutches, and some will use a scooter or a wheelchair because of fatigue, weakness, balance problems, or to assist with conserving energy. One thing that's really super important is for someone with MS, if they're in warmer climates especially, or maybe vacationing in warmer areas, to always pay attention to overheating. Overheating will tax the neurotransmitters, causing them to deplete quicker and leading to extreme and sudden fatigue. I had a patient when I worked with Bayer, who was an MS patient, and I remember them telling me the story of them being away vacationing in Disney World with their family, and he reported that he was doing fine, but it was an extremely hot day, and he was walking through the park, and he said, I just remember all of a sudden, out of nowhere, he said, I could not walk another step. I was frozen in place. I did not have the ability or the energy to lift my foot to move forward one step. This is extremely scary. I remember how upset he was, how upset his family was, but it was absolutely because he was in Florida in very hot, humid weather. His neurotransmitters were depleted quicker than normal, and they had to call emergency services in the park and have him taken away to a cooling tent. He had fluids and hydration and then felt better. But when this happens with somebody with MS, this recovery can vary as to how long it actually takes to occur. But yeah, this can be a very dangerous situation with MS. It's definitely very concerning when this happens. And the MS Society actually encourages wearing cooling vests in these situations. And cooling vests like this one here work to cool the body and therefore protect from the deterioration of the neurotransmitters and a sudden attack due to overheating, like we just discussed. So the other ways that people will cool themselves is not just the actual cooling vest. Some people will put, cool neck wraps on. They'll wear wrist coolers as well that maybe were in the freezer. Kind of all of the pulse points that usually feel really good to cool down on a very hot day. And at least when I was working with MS patients quite a bit, the MS Society, I'm not sure if the MS Society actually still does this or if they link to another site that does, but cooling vests are pretty inexpensive, but there are certain companies and charities that will provide a whole box of cooling materials for newly diagnosed MS patients. So I remember, turning a lot of people onto that, and it was extremely helpful. So if you don't know about that, I highly recommend you check out the MS Society. I will link it below in the description as well. So what can be done about MS now? So if you've been diagnosed with MS, the National MS Society recommends you consider treatment with one of the FDA-approved disease-modifying drugs as soon as possible following a definite diagnosis of active relapsing type MS. These medications, called disease-modifying agents, help to reduce the frequency and severity of MS attacks, the number of new lesions in the central nervous system, and may slow the progression of disability. These medications are approved for relapsing forms of MS, which include clinically isolated syndrome, relapsing remitting MS, and active secondary progressive MS, also better known as SPMS, with relapses. In 2017, the FDA approved the first medication for the treatment of primary progressive multiple sclerosis. Up until then, PPMS could only be treated symptomatically. In addition to these medications that addresses the disease process, there are many medications and other strategies to manage MS symptoms as well. Why is early treatment important? Early damage in the central nervous system can occur even before you are experiencing any symptoms. Studies show that the best chance for reducing long-term disability is during the early relapsing phase of the disease. Given the medications currently available all primarily target inflammation, early and ongoing treatment helps to minimize this inflammation and also reduces damage to the nerve fibers or axons, as we learned earlier, and loss of brain tissue. Why is MS so difficult to diagnose? Diagnosing MS can be challenging. In early MS, symptoms may be nonspecific and suggestive of several disorders of the nervous system. Early symptoms that come and go may be ignored. That frequently happens. And while no single laboratory test is available yet to prove or rule out MS, magnetic resonance imaging, or MRI, is a great help in reaching a definitive diagnosis. Another really helpful test is spinal fluid analysis to see whether it contains cells called oligodendrocytes, because if they're present, then it's indicative of MS typically. Timely and accurate diagnosis. There are many possible causes of neurological symptoms. When MS is considered as a potential diagnosis, other causes must be excluded through the tools and tests outlined below. While this process of exclusion may be quick for some, it can also take much longer, with repeat testing sometimes needed. Making the diagnosis of MS as quickly and accurately as possible is important for several reasons. If you're living with really frightening and uncomfortable symptoms and need to know the reason for your discomfort, that's a good reason. Getting the diagnosis allows you to begin the adjustment process and relieves your worries about other diseases. And since we now know that permanent neurological damage can occur even in the earliest stages of MS, it's super important to confirm the diagnosis so that you can start the appropriate treatments as early in the disease process as possible. Criteria for a diagnosis of MS. So at this time, there are no symptoms, physical findings, or laboratory tests that can by themselves determine if you have MS, unfortunately. The doctor or nurse practitioner uses several strategies to determine if you meet the MS diagnostic criteria. And in order to make a diagnosis of MS, your physician or nurse practitioner must satisfy the following 3 criteria. First, they need to find evidence of damage on an MRI in at least 2 separate areas of the central nervous system. Second is to find evidence that the damage occurred at different points in time. And third, to rule out all other possible diagnoses. Doctors use the revised McDonald criteria published in 2017, which are specific guidelines for using MRI and cerebrospinal fluid analysis to speed up the diagnostic process. Cerebrospinal fluid is obtained via a spinal tap, also known as a lumbar puncture in those fancy medical terms. So in terms of the first criteria regarding two separate areas, the MRI can be used to look for a second area of damage in a person who has experienced only one attack, also known as clinically isolated syndrome, as we mentioned earlier in the video. In terms of the second criteria point, the MRI can also confirm that damage has occurred in two different points in time. This is actually called dissemination in time. The reason time is so important is because it shows there's been progression and can be evidenced either by a second disease relapse, then the appearance of new lesions on MRI scans, or by clear-cut evidence of brain damage that happened at different times. Specifically, new inflammatory lesions alongside older lesions that are no longer actively inflamed. The way we're able to see newer lesions versus older lesions is a contrast agent called gadolinium. So anybody who's had an MRI out there, you may have been injected with this contrast of gadolinium. I personally go into anaphylaxis with it, which is actually pretty rare. But yes, that was my one and only anaphylaxis experience was with gadolinium. Anyway, it will be administered through an IV catheter prior to your MRI and is used during the MRI to better distinguish active and inactive lesions. Gadolinium enhancing lesions light up and look different and represent areas of active inflammation. In some circumstances, the presence of oligoclonal bands in a person's cerebrospinal fluid analysis can be used instead of dissemination in time on an MRI to confirm the diagnosis. Tools for making a diagnosis. First is medical history and a neurological exam. Your healthcare provider takes a careful history to identify any past or present symptoms that might be caused by MS. They'll gather information about your birthplace, your family history, environmental exposures, history of other illnesses, and places you've traveled that might provide further clues. Then they'll perform comprehensive neurological exams, which include tests of the cranial nerves such as vision, hearing, facial sensation, strength, swallowing, general sensation in the body, reflexes, coordination, walking and balance, things like that. And in many instances, medical history and neurological exam provide enough evidence to meet the diagnostic criteria. Other tests are used to confirm the diagnosis or to identify other possible causes of the symptoms or neurological exam findings. Second are blood tests. While there's no definitive blood test for MS, blood tests can rule out other conditions that cause symptoms similar to those of MS, including lupus, Sjogren's, vitamin and mineral deficiencies, some infections, and rare hereditary diseases. So ultimately, you can see that a lot goes into diagnosing MS. But if you're experiencing any symptoms that you feel potentially may be related to this chronic condition, I urge you to seek medical attention as soon as possible so progression can be slowed if it is in fact MS. There are many treatments available today and new medications and testing constantly making their way through research and becoming first-line options. So, I will see you in the next video where I highlight these medications and discuss the disease-modifying agents that are currently available right now for the treatment of MS. So, or there, wherever, but probably here.